Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
So one cannot exist without the other. But the most important thing is that it allows us to be able to really concentrate on the patient and bring the specific drug to the patient, which is the right drug to the right patient at the right time.
Welcome to Healthcare Matters, a podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. He's Dr. Robert Popovian, joining us from Washington, D.C., pharmacist, economist, and the Chief Science Policy Officer at the Global Healthy Living Foundation.
Across the country in Seattle, Washington, he's Connor Mertens, patient advocate and community outreach manager at Global Healthy Living Foundation.
And listen, our goal is to help simplify the complexities in healthcare economics and policy issues for you. So Robert, as we start this new series, it's always exciting hearing from the listeners. You ready to read a listener comment?
Absolutely, let's get to it.
But first, Alex Gick writes, "This is a great podcast that is quick-hitting and spot on. Easy to follow with all the excess technical terminology." That's what we try to do, right, Robert?
Absolutely, that's what we try to do, to make it easy and make it short so people understand and they can become advocates for themselves.
And again, that review is from Alex Gick. Thanks for tuning in. We invite all of our listeners to go to Apple Podcasts and leave one of those honest 5-star ratings and a positive review. And wherever you're listening, click the subscribe button so you never miss an episode.
Terrific. Let's get into this episode.
Robert, you wrote about a very important distinction in healthcare, one that I often hear from our patients talk about, but even I'm a little clueless. We often hear about precision and personalized medicine, and maybe I've been guilty of using it interchangeably myself. Can you tell us, what is personalized medicine? We'll start there.
Hey, Connor, it's not uncommon for individuals to mix up the two definitions. And I'll tell you why, because there's so much intertwined concepts that go along with precision and personalized medicine. So what is personalized medicine? Let's start with that. Personalized medicine has happened every day as physicians, pharmacists, nurses practice healthcare. And this is when a healthcare professional looks at the patient and really decides what is the best way to care for that individual as an individual. And this is very important because everybody has different needs. Let's say, for example, you need a blood pressure medicine. A physician may choose among a vast array of medicines that they have available to them, but they can take a look at you and see, okay, well, Connor, for example, is a younger person who works full time. He doesn't have time to worry about taking the medicine 3 times a day. So what I may want to do is prescribe something that is once a day for him to increase the opportunity of him being more compliant with his medicine, his or her medicine. And in this case, this is not different. For example, arthritic patient who may have so severe of arthritis that is not capable of infusing their medicine on their own, injecting themselves with their therapies, and instead requires an oral therapy to be given to them. So personalized medicines have happened for a very long period of time. We've been doing personalized medicine for everyone, and physicians, healthcare professionals have been practicing this by individualizing the cares of the patient based on their needs.
Seems like every doctor should be practicing personalized medicine. It's the most important way to make sure that care is focused on the patient and not some other arbitrary treatment plan. How does this differ from precision medicine?
I do agree that everybody should be personalizing their medicine and the care they give to their patients. Unfortunately, there's a lot of times that due to unbeknownst circumstances out of the control of the healthcare professional actually that is caring for that patient, that a lot of times the care that they provide to the patient becomes cookie cutter. And that's because of all of these middle people like insurers and everybody else who wants to intervene into the practice of medicine. Now, let's go back to the second question you asked, which is the precision medicine. What is precision medicine? Well, precision medicine is the principle that describes how genetic information about a person's disease is being used to diagnose or treat an illness. It is also an approach to discovery and development of new medicines, which integrates genetic information that helps researchers understand which particular subgroup of patients will most likely benefit from this treatment. My background as a pharmacologist is infectious diseases, and I worked a lot with antibiotics and antibiograms. We used to use antibiograms to identify which antibiotic would work best for the patient based on the sensitivity of that medicine to the bacteria that they may have. So it's been going on for a while, but the true evolution of precision medicine came about past decade or so when we were able to sequence the human genome, giving us a better understanding and the underlying disease in such areas as oncology and immunology. And the more we found out about cancer as a disease in the genome, and the more we learned about tumors, we were able to find that each tumor has its own genetic makeup. And in some companies, greater than half of the investigational medicines today are coupled with specifically bringing products in that treat a specific mutation of a genome that then treats the cancer itself. And it relies on this type of therapy. And that's why we call it precision medicine, because it precisely affects that disease in that patient instead of being like a scatter shot.
Right. And like you mentioned earlier, especially folks living with chronic disease, these are very important phrases and topics for them. And I've certainly fallen into the trap of using these phrases interchangeably myself. Robert, why is the distinction important? Why is it so important to patients to know what one means and the other means?
The reason it's important because they're also intertwined. Because you have to do precision medicine, but you also have to bring the personalized level of medicine to the patient. As I was explaining, even though it's very important to pick the right medicine for the patient through precision therapy, but if that precision therapy is not going to be able to be taken by that patient, because for example, what we just talked about, if it's an arthritic patient who cannot inject themselves and they require oral therapy, then you need to basically change the course and use something different that will fit the best needs of that patient. So one cannot exist without the other. But the most important thing is that it allows us to be able to really concentrate on the patient and bring the specific drug to the patient, which is the right drug to the right patient at the right time. And that's why they need to work cohesively together as partnerships between precision medicine and personalized medicine to really take care of patients on an individual basis.
All right, Robert, thanks to you. We're all experts on precision and personalized medicine. Tell us, what is the importance of personalized and precision medicine? What are the positive benefits of doctors using these tactics?
It's to stop treating patients as homogeneous individuals and become heterogeneous. Each individual is very different. And that's why physicians and scientists and pharmacists and everybody else has to look at the individual patient and be able to treat them. The fortunate part is that there's more and more investment going both in personalized medicine and precision medicine. A few years ago, we passed the 21st Century Cures Bill that incentivized even more development of precision medicine and ability to bring more of those type of therapies into the marketplace. Now it is up to the healthcare professionals to be able to take those medicines that are precisely used for certain diseases and apply them to the patients that really need them on a personalized level. And that's what's the most important thing, is to be able to work symbiotically between the two concepts and bring the best care to that patient.
In the work that we do, being patient advocates or a pharmacist, we're always trying to find better health outcomes for patients. How can precision and personalized medicine improve the health outcomes for patients?
It's through education. So you can pick the right drug for that patient and provide them the right care at the right time. Without that ability to do that, what you're doing is basically providing a cookie cutter solution to an individual. We know that each individual is very different. I may be the same as a human being as anybody else in my age group, but I have different needs and different wants from what I need, and my genomics are all different, and I may be affected by therapies differently. So each individual has to be done, and patients should require their healthcare professionals to think about it from that perspective. So not only give them the precision type medicines to treat their disease, but also treat them as an individual to make sure that they get the best care.
Well, as always, thanks, Robert. I'm not going to be using precision or personalized very interchangeably anymore. As always, I want to make sure you get the last word. What should patients know?
Understanding the differences between precision and personalized medicine will bring about a transformation in practice of medicine, which is very important for patients. This moves us away from one size fits all in treating serious diseases, especially chronic diseases. Supporting policies that advance these two concepts will bring life-saving therapies for patients waiting for the next cure in the deadly diseases that they face. We hope you learned something too. We'd love to hear from you. Share your ideas about precision and personalized medicine that your healthcare professional may have talked to you about or provided you, and send us an email, and better yet, including a short video or audio clip at healthcarematters@ghlf.org.
Don't forget to subscribe to us on Apple Podcasts, Spotify, or wherever you get your podcasts. And if you like the podcast, don't forget to leave us a review. It really helps people like you find the show. Thanks for listening to Healthcare Matters Podcast, part of the family of podcasts from the Global Healthy Living Foundation. He's Dr. Robert Popovian.
And he's Connor Mertens. See you all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.